Moving on to health news this morning, November is Lung Cancer Awareness Month. Each year, 1.6 million people globally are diagnosed.
And the good news, there is good news. Recent advances in lung cancer screening and early detection are providing hope for patients and their families. Joining us this morning is Dr. Marc Mcclelland. Good morning, Dr. Mcclelland.
Good morning.
How are you? Going to take a picture of yourself with a Coca-Cola bottle?
You know, I might do that.
Interesting concept,
always
right?
wanted one.
Made you laugh. I mean, that just seems silly.
Get your attention.
Early detection, I was reading some of the rates, and a lot of times when we talk about cancer, we talk about 5-year survival rates. The early detection plays a huge role, between 5% all the way up to 50, 60, even higher?
Yeah, and for lung cancer, that's particularly important. The current situation, unfortunately, is that at least 60% of patients are diagnosed with lung cancer at a late stage when it's not very curable. 5-year survival, as you say, is only about 4%. But if we can diagnose it at the earlier stages, the survival is much better, on the order of 55 to 75%. So that's where screening is so important for finding those cancers early.
Absolutely. It's truly life-saving to get early detection. How do you, I mean, I'm assuming most people realize they have a problem with their lungs when they have a hard time breathing or there's some type of heavy coughing. How would you know to get an early screening test done?
That's a great question. There are many different symptoms of lung cancer. It could be an unusual cough, it could be pain in the chest, it could be weight loss, coughing up blood, certainly of concern. But unfortunately, most patients with early stage disease, when it's the most treatable and most curable, don't have any symptoms. So that's where screening is helpful for identifying patients before they become symptomatic.
What are some of those risk factors? I know the one that pops up in everybody's mind, people who smoke, but it goes way beyond just smokers, right?
It does. There are a number of risk factors. Smoking is certainly the most common. About 40% of people diagnosed with lung cancer are current smokers, and about 45% are former smokers. Only about 10 to 15% of lung cancer patients are never smokers. But there are other risk factors as well. Asbestos exposure is one that we see, radon exposure. Certainly a personal history or a family history of lung cancer is a risk factor. Having been treated with radiation in the past is a risk factor, and advancing age and diet may play a role as well.
So really it could run the gamut of just about anyone. You said 10 to 15%. People who've never smoked in their lives can get lung cancer.
Correct.
What does the screening process entail? Am I just basically going to my primary care physician, or does it go a bit deeper than that?
So the question is, how do we screen folks effectively? Many types of cancer, like colon cancer or breast cancer, have had effective screening programs in place for many years and have saved lives. And until recently, that wasn't the case for lung cancer. But now that we have low-dose screening CT scans, there's new hope. The National Lung Screening Trial was a very large, multi-center trial that looked at thousands of patients who were at high risk for lung cancer, and it gave them a screening CT, and then one every year for the next 2 years. And what they found is they were able to find lung cancers at an earlier stage and reduce lung cancer mortality. Now, high-risk patients for the study were defined as over age 55 with a heavy smoking history and having quit within the past 15 years or still smoking. But we do know, as you pointed out, that some patients will develop lung cancer who don't have those risk factors. Maybe they're younger, or maybe they're non-smokers, and we're working on becoming smarter at identifying those other high-risk people as well.
And I always think of secondhand smoke. You know, the parents or whoever that, you know, have the young children nearby or whatever, and the exposure and the risk that they're putting those kids at.
Yes, secondhand smoke is a risk factor as well. Thanks for pointing that out.
Yeah.
And so when we're talking about the screening, what's the first step? I'm watching this on television, I'm thinking, you know what, I really, even if I don't have any symptoms, I think it would be smart for me to at least have some peace of mind. What's my first step?
Yes, so you can call the number 616-486-LUNG, and you'll be connected to one of our lung cancer screening nurses who will take some information and find out if you're eligible for a screening CT. And if so, you can be scheduled at any one of a number of Spectrum facilities close to your home.
Okay.
Well, thank you, Dr. McClelland.
Fantastic.
Appreciate the information. Obviously something that you want to look into, and of course the national smokeout is coming up as well. Great time to quit. If you've been diagnosed with cancer and would like a second opinion or consultation, you can always call 855-SH-CANCER. That's 855-742-2623.